So this is on the IT tensor fascia lata. If I put pressure on it, feel that little knot right there, kind of gritty. I'm going to put pressure on the TFL directly. Now lift up your leg, and that should feel really good. Good?
Yeah.
Okay, so we know that support here helps. It gives it the strength. You can actually see a little bit of redness. If I go posterior toward me, this is where the angle needs to come in from back here. Now you get into the demarcation between the gluteus max, gluteus medius. Minimus is buried in here. It's fine. It's doing its job. He can stand on one leg. He's got good strength in it. But the medius has a tear. The medius has a tear, and it goes underneath the glute max, so he picks it up all the way up into the SI joint, just at the inferior angle. The lateral border of the sacrum is the attachment for the glute max, and it's weak. It's not in spasm, it's just weak because it's carrying all the load for everything else. The initial tear on the hip flexor at the origin on the lesser trochanter is what started this thing. Then all those other internal muscles of the hip basically said goodnight. They just quit working. There was a tear, a tear, and a tear. Now right there, I'm on him. Good and tight on top of the ilium. I'm right at the junction between the gluteus medius and gluteus max. Now I'm going to bring this leg back toward me. How's that? Good stretch? Yep. And we'll do the traction on the other side, okay? So everything I'm doing here is just basically trying to de-rotate. The left side is so unstable. So now we got to work our way back. Okay, put your leg, remember how we did this before? Bring your leg back toward me. That's the one where you come back into the 15-degree angle.
Good.
Yeah, feels good because you're contracting the lower fibers of the glutes.
Yeah.
So the glute's doing its job. It's holding everything together. Got one muscle working. The other ones are on vacation.
It just feels like, to me, everything has been slid down with this injury.
Yeah.
It's all slid down my leg.
Makes
I
sense.
want all the energy up here, right? So we're going to try to bring it back up.
Oh yeah. The instability of the left SI or sacroiliac joint occurred because of the tear. Everything else went south. Everything else started screaming and hollering. There's 6 little muscles that hold into that hip socket, and they're all flared up.